This is just an example of an ARCHO organisational chart. It depends on the size of the health service. You have a health service of about 120 staff to a health service of 3 or 4. So within this, the Aboriginal community is the ones that have overall say for the Aboriginal Health Service. Then they elect through an AGM, a board of directors, or through their own meetings, a board of directors to represent them. Then through the board of directors, they have a CEO or health service manager. If it's a bigger organisation, normally you'll have a CEO. With a smaller health service, you'll have a health service manager. The CEO or health service manager are the operational body of looking after the operational side of the health service and are responsible to the board of directors. Then the board of directors are responsible to the community. And then under the CEO or health service manager, you'll either have units or staff members again, depending on the size of the health service. I think it's important here to note that for the Aboriginal Community Controlled Health Service, the roles are becoming a lot more clearer and defined now in the fact that your board of directors don't deal with the operational side of things. The CEO and the staff and the units deal with the operational. The board of directors deal with the governance side of the health service and also answering to the Aboriginal community through relevant forums and meetings. It's important that the board of directors and the CEO or health service manager have clear roles and responsibilities because it can become very complicated. For the board to get involved in operational can cause issues. For the CEO to not allow the board to deal with the governance issues, again, it becomes complicated. So it's very important to understand the roles and responsibilities formally and informally through all of that. As a board member of Danila Health Service, it's not always an easy task. There are always things where the community expects you to take on issues, whether it's operational or governance, or even as a community responsibility. You have to be very, very strong and get the person to understand and respect your position, that it is a complicated position of not sort of being the person that can deal and solve everything, that there is a structure, and sometimes that's very hard. I think for a younger person, for me on the board, it's a bit easier for me to look at formal structures, to look at clear roles and responsibilities. For the older mob, they got their old ways. They got their ways of going, I need to make sure our health service is strong, that our health service is meeting community needs. They don't think about, well, if it's operational or governance sometimes, because that's not how they think about things. When you think about when the Aboriginal Community Controlled Health Services were established, it was, like I said, about having a health service that was owned and operated by the Aboriginal community for the Aboriginal community. So the Conceptual Framework for Aboriginal Community Control, it came from Sydney, Redfern community in 1971. Back in those days, it was to address the blatant discrimination experienced in mainstream services and due to the ill health and premature deaths of Aboriginal people. I think it's still an issue to this day in that a lot of Aboriginal people still do not want to go to get their health needs treated for a various number of reasons. One is limited access of being able to access culturally appropriate health services, and two, a number of them, if they can't see what's wrong with them, they don't think anything's wrong with them until things are too late. So Redfern was the very first Aboriginal Community Controlled Health Service set up. I was fortunate enough 2 years ago to be able to go to the Redfern 40-year anniversary. It was really, really inspiring to see, especially the old people that helped set this up, to advocate and lobby to say enough's enough, we need something, and our own Aboriginal health service to be able to get our mob to come in to get treated. The passion, and even just some of them just in tears to see how proud they are of how much it's grown from this little place that started off with a few staff, and the amount of work that they had to do to get that to what it is now is just unbelievable.